good afternoon everybody. Nice to see lots of familiar faces in the room. And I'm going to give you a presentation about the Academic Health Science Network that's been set up for North West Coast. Talk about what we do, our role as a system integrator and how that fits really well with this project. We're really keen to support it. We've put some pump prime funding into it and we're going to be putting some staffing into this and another project that's working across Lancs to make sure that we have a joined up data system. So our strapline is innovation and health connected. So you'll see that that fits really well with big data, integrated patient records. And the North West Coast is part of a network of academic health science networks. We were established by the Innovation, Health and Wealth policy that was part of the Treasury's function to look at the concept that health is wealth. How can we encourage life sciences business to settle in the UK, specifically for us to settle in our region, and how can we improve the health of our residents and decrease inequalities to healthcare provision across the country. So there's 15 AHSNs. In the Northwest we've got North West Coast and we've got Greater Manchester. And we've got this single national structure. So if we do something really well in our region, we can roll it out very quickly across the country. If we do something really badly, we can tell people about that and say, don't even try that or try it in a different way. So the whole concept is about being open, taking national lead areas and spreading out the learning across the country. So we cover Mersey, South Cumbria, Cheshire and Lancs, obviously quite a big geographical footprint, and we've got some very inner city urban areas but some really big rural areas that really lend themselves to telehealth and doing things differently. So this is the actual region. So North West Coast sounds very exotic, and how we like to describe it is we've got the coast, we've got fantastic cities and we've got fantastic countryside in our region. So it sounds really attractive. We want to talk ourselves up about all the good things that we do, but it is quite complex. In that footprint, I think we've got 21 provider organisations, 20 commissioners, we've got 2 strategic clinical networks, we'll have 2 clinical senates, 9 universities. We partner very closely with universities, so it's quite a complex landscape, but actually very exciting in terms of what everybody's got going on and how we can harness all the good practice, the research that's been put into practice to do the best we can for our residents. So we've got an executive team that's made up of a mix of people, some healthcare people, some academia, some industry people, people who've worked in venture capitalist firms. We've got a clinician on there who works at Blackpool Hospital. So hopefully a team that will help us to move forward and make a difference. We've got programme managers who sit beneath that, and one of the expertise areas that we're seeking to employ at the moment is in IT and big data so that we can make an impact on this agenda. So aims and objectives. The objective of all of the network is to spread innovation. So if we've got something that's going on in our patch that's really innovative, a new product, a new technology, a new drug, how do we spread that out and how do we get that into wide stream use? Pull together higher education, the NHS and industry to get those ideas into practice. And our universities have got some really good research ideas. They're looking to make impact with those ideas. They do a lot of work with small businesses, spin-off companies. How do we harness all that energy in the universities and all that expertise? We want to bring investment into the region. We're currently bidding for European funds and we're bidding to bring companies into the region. We've got quite a few organisations who are interested to come and work here because the living standard is good. They can get really good investment from our local enterprise partnerships. So how do we encourage them to think that this is a place they want to come and do business? So the definition of innovation is very wide. We haven't just gone for an invention definition. It's about service improvement, new technologies, systems, drugs, so it fits very well with this agenda. Sometimes innovation can be about incremental change. If you're in a setting where it's difficult to get things to move, how do you bring something in, then something else, and you move it over time, but recognising that you're actually moving practice forward. Teaching and training, we work very closely with Health Education England, the local branch sit on our board, and area-wide strategy implementation. So we're hoping that the Big Data Collaboration, the LPRESS project that I'm going to talk a bit about, we will be able to roll out across our patch, so at pace and scale, and make a difference to residents' lives. So one of the thinking of the government behind the AHSNs was that it would be a single point of contact for people. So if you're somebody in industry that's got a really good idea that you think, actually, I've talked to different institutions about this, I've looked at how a technology might work in the home, you can come to us and say, can I pilot this innovation somewhere? So we'll have contacts with NHS organisations, with community health organisations that we can say, yes, we'll help you to do that. So they're not going from institution to institution to try and get someone to help them. One of the system integration roles is about IT infrastructure. We've tried to think very carefully about what infrastructure we need across this region so that we've got a legacy of good practice in innovation, and we've got structures built up to help us to move things forward over time. On a wide footprint, things don't happen overnight, so how do we maximise the infrastructure we've got to move things forward? So our campaigns, I've talked a little bit about reducing health inequalities. Anybody that's been involved in procurement in the NHS, which I haven't been until recently, will realise it's a really unwieldy system. So if we've got something new to bring into the NHS, it really takes a long time because you can't get through the procurement processes. If you've got an innovative product, you can't get it onto the NHS catalogue. So we've said that we'll have a look at that on behalf of the national AHSN network to see what we can do with that and encourage businesses to come into our region because they know they can get their products out into the environment we need them to be in. One of our campaigns is about integrating patient records, so that fits really well with this agenda. We're working with commissioners to look at how we use technology to run our specialised services differently. Can we get some economies of scale with technology? We're working together with different institutions. And we've got a really strong digital health solution for our residents in Liverpool. People from Liverpool might know about the More Independent project. It used to be called the Dallas Project, and it's about delivering assisted living lifestyles at scale. So how can we help people to access technologies in the home, in the community, so they keep well and they don't go into hospital? So we're building on that project to look at how we can spread that learning out. And there's been quite some interesting learning from that project about what doesn't work. And what we found is trying to get people to buy the technologies in this region really doesn't work. So can we look at how we buy products in a different way? So it might be through the health system, through the social care system, so that people use them in the home. And we're also working on medicine safety. We're just looking at a really interesting product, and it's a tiny little computer chip. It's about the size of a grain of sand, and you ingest that in a tablet. So if you're somebody that has to take tablets on a regular basis, you take this tablet with a chip in alongside that, and it tracks for your doctor or your healthcare professional if you're taking those tablets at the right time, so that they can see is the treatment having an impact. If you're taking them at the right time and you're not well, they need to adjust the treatment. If you're not taking them, they can have a look and talk to you about, does your lifestyle fit with that particular drug? So there's all sorts of really interesting things going on that we're trialling, looking at and working with different institutions on. So we've got local health improvement priorities, and I don't think any of those things on the list there will be a surprise to you. We talked to partners last year about what they'd like to see us working on, and this is what came back. And because we don't want to bite off more than we can chew, in the next year we're looking at stroke caused by atrial fibrillation. Can we make an impact in that by detecting atrial fibrillation and getting people onto the right anticoagulant regime? So that's our clinical campaign for next year. And we're working very closely with the strategic clinical networks on that because they've done a lot of work on that in the past and have made some impact. So can we increase that impact and not duplicate anything that they're doing? So lots of key partners. I've told you about everything going on in our region and the varied organisations that we've got. And one of the things for us is not to duplicate. We're wasting money if we duplicate. And one key partner for this area is Liverpool Health Partners. So that's a consortium of the trusts with the universities, and we've got the Liverpool Big Data Collaboration, we've got the Lancashire Patient Record Exchange Service, and Liverpool Health Partners are working on the HERC system, which is an electronic research system using data. So our hope is that we'll be able to work on these three projects, pull the learning together and have an integrated solution right across the North West Coast area. Now we're also a member of an organisation called the European Connected Healthcare Alliance, and this is an alliance across lots of different European countries that seeks to look at health needs and match technologies to those needs. Now it's really interesting for us to be in this because there's lots of countries who are quite further forward than the UK in how they use technology to look at health need and to address some of that. So it's a collaboration of the willing, so willing partners coming together to share things. And the whole point of the ecosystem is about sharing learning. There's one on our doorsteps. Manchester has got an ecosystem. There's one in Belfast, all across Europe. And we're working with them to look at what are they doing that we could just pick up very quickly. And likewise, what are we doing that they could work with. And the benefit of this for us as well is that a lot of the European funding grants, you have to have European partners. So we've got easy access to European partners in all of these areas. So if anybody's trialling anything, if there's something they think, oh, I really want to know who else is doing that or who else would like to do that, we can make those key contacts. So I've spoken a little bit about the Lancashire Patient Record Exchange Service. Now Tony's sat at the back, Tony Shaffel, who's leading this. So Tony will be able to answer technical questions and I can just give you an overview of this project. So we came, when we were talking about the Liverpool Big Data Collaboration, we were put in touch with Tony of something that was going on in another part of our region that sounded complementary and really exciting. And the project, the Patient Record Exchange Service, is looking at interoperability across health and social care in terms of data. It's not looking to set up new expensive systems, but to look at how systems can be funneled into one system where data can sit together. So it doesn't involve building another database, so that was a bit of a wordy explanation, wasn't it? The information owner has complete control over what's published. It allows data sets to be built up for a variety of purposes, so it might be for research, it might be for clinicians to look at to see how they can plan future healthcare services. And it's been implemented across a number of countries. So we've got some evidence-based practice for this system. Working with the Liverpool project that we're going to talk about a bit later, and the Lancs project and the Liverpool Health Partners project, we've got a number of work streams that address a lot of the areas that we need to start thinking about in terms of data infrastructure so that we can plan services moving forward. So our esteemed leader has got something to say about this. David Cameron talks about data being one of our greatest assets and a systemised collection of data, and he sees that we've got the potential to transform healthcare by using data sets. And I don't know if anybody was at the NHS Expo last week and sat in on Jeremy Hunt's session. That was really interesting. I tried to sort of type up some notes about what he was saying. But in the next year, he thinks we'll have a health and care record available wherever we are. We'll have e-booking and e-consultation for everybody. Well, 90% of patients actually on that one. We'll manage our long-term conditions through apps. We'll be having a full suite of clinical data that can make sure that we can plan services going forward. He's talked about dementia, falls and clinical data. And we need to learn from the mistakes of our past IT projects. He was very clear about that, but he was really, really ambitious about what he thought we could achieve in 12 months' time. Now, I sat there thinking, that's fantastic. 12 months just seems a very short period of time, but everybody is pushing behind this agenda. So we've got the powerful people behind us, haven't we? We've got a really good start. We need to be realistic about what we can achieve. But I do think that being able to use data to drive innovation is one of our key strengths in the NHS. And I know that we've got some speakers later on who are going to talk to us about the Scottish example. And we've done some work in Scotland to look at how that system has worked. And we've done some really good work in terms of diabetes and mapping the data of people with diabetes to look at in future. Can we reduce amputations? Can we stop people losing the sight? And they've been really successful because they've concentrated on the people with the highest clinical need. They've been successful in improving outcomes for those people. So really in terms of like hearts and minds, that's what we're focusing on. There's people at the end of the day that this data can make a difference to. So there's something for our region. We've got lots of centres of care. Can we move to systems of care? Can we work together across the region using the data that we've all got locked in our health systems to make an impact on patients' lives? Can we use that data in R&D? So can we start to pull some of that data that we've got with consented patients and some of the treatments we're giving to make an impact moving forward in the future? And most of you will be sat in organisations that do a lot of R&D and seeing the effect that some of those clinical trials can have on people. It can change their lives. So how can we harness that technology, those drugs, through research data to get them into widespread use across our population? And also, we're always focused on cost, aren't we? How can we focus our spending into the right areas of healthcare because we're using the data that pinpoints where we've got the highest need? So a little bit more there on the benefits of patients of using data, and at the end of the day that's what we're all about, aren't we? How we affect residents and patients' lives through using the data to inform our healthcare treatment.